Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Today we talk about right displacement of the abomasum in cattle. What is the abomasum and the displacement of it? The abomasum is the fourth or true stomach in the cow. It normally lies low down in the right front quadrant of the abdomen, just inside the 7th through 11th ribs. Adjacent to the abomasum, on the left side of the abdomen, is the large first stomach, or called ramen. The abomasum occasionally may be displaced to the right of the abdominal wall and upwards when its muscular wall loses tone and the stomach becomes filled with gas. Right displacement of the abomasum twists in two planes, one its longitudinal axis and on its mesenteric or omental axis. When abomasum moves from its normal anatomic location and becomes entrapped between liver intestine and right abdominal wall. This photo is the normal positions of the abomasum, and this photo will show the right displacement of abomasum. And this photo is the normal location of abomasum, and that the right displacement of abomasum, that the liver, and that's the abdominal wall, and the abomasum is a trap between them. The displacement syndromes are most common in high production dairy cows, but also appears sporadically in calves, dairy bulls, and beef cattle. Right displacement are distributed to the first 3 months after calving. Right displacement of the abomasum accounts for 10% of all displacement. Right displacement is more serious condition than left displacement, and recovery rates are lower. Sometimes the right displacement abomasum turns into a much more serious and often fatal abomasal torsion. Clinical signs of displacement. The common clinical signs during the displacement of the abomasum are: first, loss of appetite; second, decreased manure productions; third, decreased milk productions. In the case of animal with right displacement can show more severe signs including colic, elevated heart rate, scant feces, and diarrhea if a torsion occurs. Animal can go downhill very rapidly, showing signs of severe shock with cold, extremite, and extreme dullness, dehydration, and large amounts of gas and fluid collection on the right side. Diagnosis. As a vet should perform the following diagnosis: physical examination in the first, and the second rectal examination, third simultaneous auscultation and percussion or binking of the abdomen. A binking noise is heard when there is a gas-filled organ against the body wall, such as displacement abomasum. Passage in the fourth, passage of nasogastric tube through the nose into the stomach to test the fluid from the ramen. And finally, a blood work evaluation. The etiology and pathophysiology of the right displacement. The primary causative factor in abomasal displacement appears to be atony or hypotony of the abomasums, and the second, increased abomasal gas productions. And the dysfunction of the intrinsic nervous system are thought to play an important role in development of displacement. Dairy cattle with high milk production and being fed large quantities of grain where exercise is limited may have abomasal atony. Other contributing factors decreased abomasal motility include metabolic disorders, like hypoglycemia and ketosis. Concrete disease as mastitis and meteoritis. For note, concrete disease is related more than is related at that period than in the left displacement more than the right displacement. Hypomotility is also related to ingestion of high concentrate low rage diet, which reduce abomasum motility through a poorly defined mechanism that may involve hyperinsulinemia or increased concentration of volatile fatty acid. One of the mechanisms of excessive gas accumulation in cattle with abomasal displacement is reticulum-mediated inflow of terminal gas into the abomasum that is a hypomotile. In addition, high concentrate diets result in increased gas production in the abomasum. Mostly these gases as a carbon dioxide, methane, and nitrogen. Finally, subclinical and clinical ketosis increase the risk of abomasal displacement through an unknown mechanism. They may be associated with decreased ramen film. That's the end, and thank you for your watching. I hope you enjoy. Goodbye.